Thank you for joining us. Our special guest today is Dr. Fred Lippman, Chancellor of Nova Southeastern University's Health Professions Division. Dr. Lippman is an extraordinary healthcare chief executive officer, and he's overseeing 6 colleges, including osteopathic medicine, allied health and nursing, pharmacy and dental medicine, optometry, and more. With thousands of students and a staff of over 1,300, he has endless responsibilities and will share his thoughts following these messages.
Life Extension magazine brings you new discoveries in health and anti-aging. Our science-based research and supplements are so advanced they're many years ahead of the medical mainstream, with quality control standards that exceed FDA mandates. Life Extension has covered groundbreaking medical research for more than 35 years. For your health and future, you deserve the best. Learn more at lifeextension.com.
Carrier asks, what does comfort mean to you? Is it a cool breeze on a scorching day? Or a cozy corner on a cold night? That every room of the house is as inviting as the next. And the air is fresh and clean for everyone. That humidity is where it belongs. At Carrier, comfort means more than just the temperature. And the people who invented modern air conditioning keep inventing new ways to make you comfortable, however you define it.
When I was young, it seemed that life was so wonderful, a miracle. Oh, it was beautiful, magical. And then they showed me a world where I could be so dependable. Oh, intellectual, cynical.
Find magic again. Sprout by HP. With Intel RealSense technology inside, now you can bend the rules of creativity outside.
With us now is Dr. Fred Lippman. Doctor, it's such a pleasure to have you back on the show.
Thank you, Richard. Good to see you again.
Good Lord, it's been quite a few years since we last had the pleasure.
So you look pretty young. I don't know how it happens, but you must be getting some of that fine Israeli medical health technology, all the biomedical things that keep you young, huh?
Well, actually, I'm constantly sitting excessively. But speaking of research in Israel, they now actually just did a 3D printing of a human heart with the actual human tissue. Interesting how technology and science are able to further imperative causes here.
Well, you know, it's a very interesting thing that you bring up 3D printing, because here at Nova Southeastern University, you know, we're known because we were at the Alpha Project, believe it or not, for the internet. There were 2 universities in the United States going back to when Abe Fischler was president of this university. We just finished redoing the Health Professions Division library, which is what we call a collaborative library. In other words, today, in today's world of libraries, and I love libraries, I went to Columbia University, which has one of the most beautiful libraries in the world. But they too have now entered into a period of realizing that it isn't the holdings or the stacks, the number of books you have, it's the ability to present the knowledge. So much is presented now through technology that the students are sitting there and receiving information from databases, which is literally the same thing as turning a page, but now it's coming onto their laptops or their what do you call their computer plates, whatever you want to call it. But you mentioned 3D printing. We have 2 3D printers embedded in the library, and it's a great teaching tool because we now are using 3D printers shortly in our new campus in Clearwater in the Tampa Bay region of Florida. We're about to cut the ribbon on a 350,000 square foot health professions building structure, which will have the College of Osteopathic Medicine and multiple programs in the College of Healthcare Sciences, PT, OT, PAs, et cetera, et cetera, et cetera, nursing. But the use of the 3D printer is amazing, because literally you can communicate through your mind and I guess you could say request the rebuilding of almost anything, whether it be an arm, a leg, or a heart. And it can be utilized like as if you're in an anatomy lab. Fascinating, and I had no idea that NOVA, that the medical professions division, actually reaches as far north as Tampa as well. Oh, we're further than that. Actually, we are regionally, we have a venue in Jacksonville, Orlando, the Tampa Bay region, which is now be very, very significant, but we've been there for 10 years. Fort Myers, Miami, Palm Beach, and our home base, in essence, is Davie, Fort Lauderdale. But we're very proud of our center in Puerto Rico. Well, this facility right here, an amazing university. You all did so wonderfully here, Abe Fischler and all of you. I was wondering, with the advances in technology and research and so forth, how is this affecting curriculum in your area? Oh, it changes it dramatically. Firstly, we have a new school, a new MD school, a new School of Allopathic Medicine, which just took its first class. The School of Osteopathic Medicine that was the mother school, created by our founder, Dr. Morton Terry. Goes back to 1978. Took its first class in 1981. But the whole issue of technology has been really the element of creating changes constantly over particularly the last 8 to 10 years in our pedagogy. Because what you're doing now is, rather than relying on slide projections or handout papers, you're using technology. We even do all exams on products where you can be sitting next to me, I could be sitting next to you, and your questions are dissimilar to mine based upon the way the technology will scramble it. So it allows you to see things that are much more directive relative to, for example, anatomy or biochemistry or things of that nature, where you actually project the questions. You don't have to just use words. You can use analytic, formulas, or you can create certain venues of the anatomy where you say what is a problem here and what is the cure here, etc. I'm being oversimplistic, but has it affected the I guess you could say the style and the presentation of education in healthcare? Absolutely, 100%. We've gone to small class environments rather than amphitheater environments, because small group teaching we find it to be more, shall we say, available to the very, I guess, advanced student of today that uses social and technological and visible media beyond the reading text. Our main sponsor is Life Extension, which is doing research into the diseases of aging and so forth, and stem cell research and CRISPR-Cas9. In fact, I'm supposed to interview Dr. George Church at Harvard at some point in the near future, talking about his very interesting theories and practice. He's actually self-experimenting, I am told. Tell us about research into the state-of-the-art
in your general field, such as DNA editing?
That's part of a unit that we have, and I will explain it to you. We have a number of institutes. We have, since the last time that I've spoken to you, we've built a $120+ million research facility on this campus. It's state-of-the-art. And some of the areas that we're focusing on are cancer therapy, dominantly breast cancer, and ovarian cancer. We're also doing immunosuppressive diseases. It started out with one of the world's, not just the nation's, one of the world's finest researchers in the area of immunosuppressive diseases, Dr. Nancy Klimas, who is here with a compendium of clinicians, researchers, technology folks, computer tech people, and they're applying all of the new approved standards which come to us. And I will tell you that they've come up with some very innovative new, shall we say, treatment programs for immunosuppressive diseases. You know, originally she started out, Dr. Klimas started out with Gulf War syndrome, which occurred after the first invasion of Iraq, because there were thousands upon thousands of veterans that came back afterwards, and 5, 8, 10 years later were having multiple abnormal, shall we say, experiences. And I'm not talking about mental, I'm not talking PTSD, I'm talking about you know, lung problems, cancer, things that no one could figure out what was happening. Dr. Klimas is one of the renowned researchers in the world working on that. As far now, relative to your question, we have very, very significant computer sequencers that deal with the biomarkers. So we're not quite at the point where we're using certain products because they have to be approved by FDA, but we use certain techniques which come to us through collaborative work. In fact, we're now ready to sign a collaborative agreement with one of the universities, and I won't name it, in Israel, that is doing just that. So we're going to try to bring collaborative work here. In the area of cancer, we are affiliated with the Karolinska Institute in Sweden that enables us to have some of the most well-known researchers in the world, because they're the ones who make the decisions on a Nobel Prize. Karolinska does. And they work with us here at our research facility. So we're into doing the things that you related to in your very first question, is do we do things relative to biological, shall we say, research or biomarkers and things of that nature? Yes, we are, but we're doing it collaboratively with institutes at this point in time from Europe and hopefully from Israel within a very short order.
All very fascinating. And actually, speaking of Israel again, recently they were saying that they are kind of on the verge of or already have actually found cures for cancer.
You know, in my spare time, I do a lot of reading, the old-fashioned way. There's a tremendous amount of research that's going on in Israel. You know, it's an interesting thing. You bring up this whole subject, and I know the focus of this show is to communicate the wonders of the Israeli entity, all right? It's more than just a government. It's more than just a place for the Jewish population to say, this is my homeland. It's an entity which is a diamond for progress in the world. A lot of that technology came from Israel. And again, it's not because it's a Jewish state. It's because it is a place where the interests of Israel in the world is prominent. I mean, they don't do research for the population singularly of Israel. They do it for the population of the world. And, you know, we're working with them at our Guy Harvey Institute, for, which is on the ocean. We're one of the leading venues in the world on research for sharks and on the areas of coral reefs. And we're working with the experts in Israel right now to understand the devolution of our oceans. So, I mean, I've just jumped from cancer therapy to Gulf War syndrome to the oceans, but that's what research is all about.
The interdependency we have, obviously having to live in harmony with nature.
Oh, absolutely. I mean, you know, I was always amazed. Many years ago, I went with President Hanbury, the president of Nova Southeastern University, to see Scripps in California, the Scripps Research Foundation, which obviously now has a venue here in Jupiter. But you know, when I spoke to the scientists, I realized that they weren't, you know, they didn't think, they weren't oblique thinkers. They thought as scientists that could give information from one scientist to another, whether they're on one side of the building or on the other side of the building. It's like being in one country to another country. But it was a population, and the way I looked at their venue, it was like the world. When I looked and see how their walkways and their little dining areas and everything, to me it was a mall of thought. And I always say to people that when they think of the United States, when they think of Israel, we don't create just for ourselves. We create for mankind, otherwise known as the world, as mankind, womankind of the world.
Speaking of the redeeming features in a, unfortunately, often somewhat ignorant world, I would say that the health sciences that you preside over here at Nova are one of the really few redeeming features we have in academia. And again, I must say, with all respect, there is an abundance also of rather vague, obscure areas which I don't necessarily find very pleasing to myself, and neither the atmosphere on many campuses.
One of the goals was set many, many years ago, and I don't know whether it happened or whether it was purposeful, but I can tell you it's definitely purposeful over the last 10 to 15 years here at Nova Southeastern University, was that we're very diverse. We have students that are here with amongst our 20,000 students from 162 countries. People of different color, of different languages, of different faiths, of different cultural activities. And I really think that that lends to an environment that leads to an attitude, that leads to a process where people communicate more often.
Which is essential. I think the more people communicate, the more likely they are to arrive at realistic and truthful conclusions and coexistence and tolerance, rather than have all the prejudices that so many people seem to have.
Well, you know, this show focuses in on I guess the elements of Israel and its wonderments and many other subject areas. But, you know, when you talk about the elements of population, in Israel, very few people realize the numbers of non-Jewish faith individuals that participate in the daily functioning of everything from schooling to banking to manufacturing to healthcare to research, et cetera, et cetera. And nobody ever talks about that. Nobody ever talks about the cooperative nature of being a human being that communicates with something called the brain and something called, you know, a voice. And sometimes it isn't a voice. Sometimes it's, you know, something that you write. And I think that that's really something that should be looked at around our educational world. I think we get a lot of people that present students to the faculty that are prepared to be there based upon grades or numbers. And the truth is that here at the Health Professions Division, no one is accepted into our programs unless there's a personal interview. And why? Because you can't judge an individual just by a number grade or by a standardized test. You have to communicate with them and see whether they communicate with you, because you're going to provide an education so that they can go out and be a healthcare provider. And in order for that to happen, we need people to be able to communicate. That doesn't mean that we all communicate in great Shakespearean verbiage, but it does mean that you have to communicate with knowledge. And if we feel that, that's why we have these personal interviews.
I think that's absolutely excellent. Dr. Lippman, you know, I was thinking, you mentioned our friend Abe Fischler and the early days of NOVA, and I did interviews with him so many years ago. And the university was small, and now it's this immense university, this entity. It actually covers all of Florida. Tell us more.
Well, again, I mentioned before about our regional campuses. The reason is because there's such a shortage of healthcare providers, not only in Florida, but around the United States. I mean, there are projections that says there's going to be a shortage of 200,000 doctors in the United States by the year 2028. That's unusual, and that's because there's so many people have not gone into healthcare. They've gone into finance and other things over the years, the last 15 years. But you know, we're a beacon. We're a beacon for the United States. We're providing healthcare providers. They have no anxiety about treating in underserved areas, in rural areas, in farm areas, and things of that nature. They thrive in these areas. So I'm very proud. Just as Abe Fischler, my dear friend and your dear friend, God bless his soul, would say that we're not creating knowledge just for the people who live east of 95 or west of I-75. We're producing knowledge for the people of this nation and this earth.
Speaking of health and preventative medicine, our main sponsor, Bill Falloon, wrote the book Pharmocracy, and he's the founder of Life Extension,
Yes.
and he asked me to give this to you.
Well, thank you very much. It's interesting because in our teaching pharmacy here at Nova Southeastern University, we carry Life Extension products, and our pharmacy practitioners as well as our students are, I guess, it's not selling, but presenting the Life Extension products. So I give them my very best.
Thank you, sir. A real pleasure, and as always, so nice to be with you.
Thank
and
you.
We have to do this again sooner than last time, which was a few years ago.
What can I tell you? You know, you're getting too rich, and you know, that's it. You're getting too famous. What can I do? Me, I'm just getting old.
No, you're not. This has been such a real pleasure, and we have to do this again, Dr. Lippman. A real pleasure. Thank you, sir.
Thank you.
I'll be right back.
This simple box contains a human life. The white fluid inside is one of the world's most advanced forms of cancer treatment, CAR-T.
CAR-T cells are immune cells that we get from the patient's blood, and we actually insert a gene into those cells which give them the ability to recognize tumor cells and which also makes them much more aggressive.
CAR-T therapy is an Israeli invention, which only went into clinical trials in the past couple of years. Worldwide trials have given an 83% full remission rate, even among terminal cases.
They're extremely advanced stage when they get CAR-T cells. Currently, the product is only approved after at least 2 failures of 2 previous therapies of metastatic disease.
That life-saving treatment comes at a very high cost. CAR-T therapy begins at about $370,000 and quickly rises to about $1 million, and that's the cost per patient. Those costs have put CAR-T outside the reach of most patients. Most insurance companies balk at the cost, and government health systems have been unable to bear the load. But this year it was added to Israel's public coverage.
One thing for sure, it still continues to be very expensive, so I do expect governments to pay more and give more money for healthcare systems.
And Israel is paying more than ever. The 2019 budget allocated $125 million to cover pharmaceutical drugs. $70 million was for cancer. This has forced Israel to work on new ways to keep costs down.
So we tell the drug company, help us, include it, cut down the prices so we can add more. And it's many ways it's successful. The second methodology we use is to do risk sharing with the company. For example, deciding that we are going to pay just for successful treatment.
There are limitations, of course. Only 2 specific kinds of cancer are covered for now, and only leukemia patients aged 3 to 25. Health professionals say the country can treat a maximum of 100 patients a year this way. But it's an important health milestone for Israel, and perhaps a model for pioneering such expensive treatments worldwide.
Life Extension magazine brings you new discoveries in health and anti-aging. Our science-based research and supplements are so advanced they're many years ahead of the medical mainstream, with quality control standards that exceed FDA mandates. Life Extension has covered groundbreaking medical research for more than 35 years. For your health and future, you deserve the best. Learn more at lifeextension.com.
This concludes our special show for today from On Location at Nova Southeastern University. I'm Richard Peretz. Thank you for being with us.